Okay.
We have a second interspace neuroma right here, third interspace stump neuroma. Already had previous had neuroma surgery. How long ago?
2 years.
2 years ago, and it came back already. You can feel it by squeezing. I'm squeezing with this hand, and then I'm pushing up and down with this one. I can actually feel that neuroma in here, and I can feel the neuroma in here now. Her main pain, she came in with underneath the second. She also had it underneath the third, and now she's numb. So I gave her a little local anesthetic here, and local anesthetic up here in preparation for the radio frequency ablation. So we're gonna go ahead and get that started. We're going to take a look at the ultrasound. We're going to look at the ultrasound image, what a neuroma looks like. I'm going to go, we're going to look, this is peaky number 2, peaky number 3, peaky number 4. You can see number 4 is all the way over here, 4, 3, and 2. That's how we're going to orientate ourselves on this ultrasound. And a lot of times when people have, they have no idea what they're looking at on the ultrasound, they can't find the neuromas. Well, here you go. Here's a nice little round neuroma between 2 and 3. Here's a nice big neuroma right here, which is what she's feeling. I'm going to ask her to relax her foot for me. Okay, I'm going to squeeze. You see the nice round circle actually squeeze. You see that? It moves a little bit, dark round circle. Again, you see that neuroma right here. It's going to see again, we're going to see it move right there. That's the object that we're going to go in and do radio frequency on. Now, I'm feeling a little click in her foot. That's called a motor sign. That's the click of the neuroma. Again, we're looking at that neuroma between 2 and 3. That's the one we're going to hit. That's the one that didn't have surgery on. Okay, that's the one. Again, I'm rechecking it. That's where my probe is going. Now number 2, between number 2 and 3 here, between 3 and 4, I'll take that back, between 3 and 4, that's third and fourth toe here. It's not as clear because she already had surgery in there already, but you can see some scar tissue in there. You can still see the little roundness going on in there. It's not as big. You see the tissue there is a little bit unorganized, but you can still see when I squeeze some tissue moving up and down right there. Going underneath, you see that? I'm gonna do that one more time. That tissue is gonna glide over underneath the knuckle there, causing her the pain when she walks. See, go. When she's walking, that's where it's gonna go. Go, and she's gonna step right on that. That's gonna be painful. Again, we're gonna go to 2 and 3 now. We're gonna look at that neuroma. I'm gonna go ahead and you see it very well visualized right there. Look at that little circle right there. You see that? Again, we're gonna keep our eyes on this one. This right here. I'm going to squeeze it. I'm going to compact that nerve. And it looks like that now. People say, hey, how do you find these neuromas on an ultrasound? Well, I'm used to looking at it for nerve blocks. I use it for nerve block here. I can see the nerve injected there. So it takes a little bit of experience to find these neuromas. But once you do, they're pretty easy to find on the ultrasound. As you can see, we just did a quick examination of 2 spaces. She's already numb. She's ready for radio frequency ablation. We're gonna get it started. So we're gonna turn off the camera for a second until we're ready. Second, and this is between the second and third toe again. 2, 3, and 4. That's the neuroma. You see the vessel pumping right here? That's the artery. That's the nerve right here. See a little pumping artery, and that's the stump neuroma right here. Okay, not as organized. It's a bunch of scar tissue. She already had surgery, so we're not going to rehash that. We're going to go ahead. I'm going to go ahead for the radio frequency. I'm going to start putting the probe in. Again, remember that's the one I'm going to hit first because that's the biggest one. So I'm going to go ahead from the top down. She's already numb, mind you, so she's not going to feel it very much. I'm going to go down, break the skin, take the probe out. As you can see the movement now. You see that nerve being moved by my probe. Right there. You see that little, this is a patient wide awake looking at me playing around with her foot here. So again, we're gonna keep the probe right about here. You can see it, my probe coming up from the bottom right here. You see the little metallic probe right there. I'm going right into that nerve right there. Right at it. I'm gonna feel that. Again, see that metallic probe right there hitting on that nerve. So I'm gonna stop it right, I'm gonna stop the ultrasound images right there, because I know I'm in the nerve. I'm gonna touch it, I'm gonna touch it right here, just to make sure I'm not too deep. I'm right at the nerve. Now we're gonna go ahead, I'm gonna take the radiofrequency probe. This is the radiofrequency tip. Again, this is the tip that's gonna burn to 90 degrees Celsius. It's gonna burn that nerve. Again, we're gonna be right here. We're right in there. Again, I double check the placement, and nothing beats manual touch, because I can feel how big her nerves are. So it's not moving now because the probe is right in it. The probe is right in that nerve, so the nerve and the probe is moving at the same time right now. So I'm confident we're in there. We're not too deep. We're not too deep to cause soft tissue burn, but we're deep enough to be in that nerve itself. Again, the nerve is moving. Not too deep. Perfect. Ultrasound confirmed. Movement is within the probe. We'll go ahead and do that burn 90. Go ahead. The assistant's going to turn on the temperature. We're going to go up to 90 degrees Celsius. We have hit 90 degrees Celsius right now, and we're going to start the timer for 90 seconds. So nothing exciting happens for 90 seconds except that it's burning at 90 degrees. A lot of it is the feeling. Right? Do you feel anything, pain or burning?
I feel just a tiny little heat there, but...
Perfect. Perfect. So that's the procedure itself of the radiofrequency. I burn the nerve about 2 or 3 times per nerve. Again, I search for it via this ultrasound, brand new ultrasound right here by GE. Great imaging. Get it in there exactly by the nerve. So there's no complication of open surgery. You get a regrowth, like in 2 years you had a regrowth and it's painful and the pain. To go in there, we're looking at a lot of scar tissue, we're just doing something called a spacectomy. We're taking out everything in that space. So that's not really the ideal way to do things. And there's 50% chance of complications with open surgery, so I tend not to like to do that. This is the better way to do it. And patients typically get 50% relief to 100% relief for the first treatment. Second treatment a month or so later, we go up to 80 to 100% relief without even having to do surgery. That's all I do. There's no cuts. And we just go ahead and redirect the probe and burn the nerve in particular areas very accurately with the ultrasound back.
How old is this therapy, this treatment?
This therapy has been around for many years. It's actually been around for the back of the neck and for tumors, of cancerous tumors, but it just have not been used on the foot as much, but it's the same as that concept. You can inject the nerve, find the nerve, you can burn the nerve, but it's the same exact thing.
Makes sense to me.
Yeah. So I know I'm in the general vicinity, so for the second burn, I'm just going to move my probe up, right about here. Move it up here. Surgically, I feel the nerve. Look at my thumb right here. Let me go a little bit further, deeper at the front of the nerve, right here. Again, I'm going to check the clicking of the nerve. Probe is right in it. I'm going to click. Okay, now we're going to go and burn that for 90 seconds. And we're going to stop recording until... I am here in the third interspace right here. There's a little scar tissue with. There's not neuroma. We're going to take a look at the ultrasound image. You're going to see that my probe is again pushing in the soft tissue right here. That's the interspace that I'm in right now. So we're going to take a look at it. Again, the probe is through the scar tissue. I'm going to go towards the second toe. The neuroma is, again, I'm pushing right here. Boom. I'm right at it. So the accuracy of this is pretty good. The probe is going in. See the soft tissue lesion? The probe is coming in. You'll see when I push in, it's going to probe right into this neuroma, this stump neuroma right there. And push right into it. You can see that probe come right in. My patient, being a pharmacist, can appreciate some of the anatomy here. It's a nice conversation about where we're from. So right here, again, we're going right in that dense tissue right there. That's all scar tissue, stump neuroma, etc. Again, this is just my probe. I'm going in towards your third metatarsal, and you can see my probe going out, coming back in. So right about there. Okay. So the placement is very accurate. Again, you see that probe bouncing in there. That's where your neuroma was, or start neuroma, and I'm right next to it. All I have to do is burn the tissue around there. That's gonna help you get the pain relief that we need. So you did have a stump regrowth neuroma, and then I'm gonna do it by hand. Touch it by hand. Again, I feel the soft tissue. Take the trocar out. Okay. Now to the blunt tip now. A lot of scar tissue. We're right at the site. Again, we confirmed it with ultrasound. It used to get a nice little bounce. And a lot of scar tissue. Go ahead and reposition this one more time. No more crunch. Nope. The crunching is there. You can feel that crunch. About here again. You can see my probe move. That is the nerve. We're right at it. Here again. We confirmed it with ultrasound right in the general vicinity. You see, I'm meeting some resistance because of all the scar tissue in here. But now, the probe is moving with the nerve. Right here. Right at it. My probe is moving with the nerve now. I don't feel an independent moving nerve. It's right at the probe is right at it. You saw it already on the ultrasound. This is just placing it right at the center of that nerve. We're going to go. And again, readjust the position. Note that that's good. Do the click test again. Note that we will note that the probe is right in the nerve. We're going to go ahead and burn first. Go 90 seconds. So part of it is by visualization, the other part is by feel. And here so now we're burning at 90 degrees Celsius right now for 90 seconds. So we are hitting there right now. And here we go. Good.